I'm Dr. Michael Foreman. I'm the dental director of our program here. I was in private practice for 35 years, and then 10 years ago this clinic was opened and they asked me to come and help get it started. One of the unique things of our site too is we have a pediatric dentist. Not many AEGD sites have their own pediatric dentist. Some of them have a pediatric dentist that rotates through maybe once a week. But we have one full-time. We have 4 chairs just dedicated to pediatrics.
I'm Dr. Iman Dajani. I'm a board-certified pediatric dentist. I see kids ranging from newborn to 16 years of age. We use different behavioral modification techniques. We use nitrous oxide for behavioral management. We do oral sedation. And for medically compromised kids or uncooperative kids, I see them at Dayton Children's Hospital under general anesthesia to complete their dental treatment. The residents rotate here once a day with me. They work under my supervision, and they get the experience of seeing pediatric patients from 8 to 5.
I did a 2-year residency, so when I came here, I was able to do most anything, didn't have to refer people out. And that's what this practice is going to train you to do, be able to be pretty much on your own, or if you go in as associateship, to be able to offer some unique and advanced services to the people that you're going to work for.
My name's Logan Halderman. I'm one of the dentists here at Family Health, and I help with the residency program. I knew I was not ready from dental school to be on my own, so I was looking for a place that was going to be with people who knew what they were doing, who was willing to help me progress my dental skills. So that year of residency was amazing. They were great mentors. I learned so much, my confidence grew, and I loved the place so much that I actually ended up staying, and I've been here ever since on staff, and now I'm teaching residents, and I can help, I think, relate to them because I went through what they are going through pretty recently. And the other, I think, huge plus to this program is we don't have production goals for our residents at all. We will give you as much time as you need to do a procedure. So, hey, you're doing your first molar root canal and you think you need all morning, we're going to let you block that time. And we're not going to ever be telling you, hey, you need to do this in less time. We do want, obviously, to see your speed increase throughout the year, but it's going to be something that we kind of let you determine where you're at with your speed at that time.
I'm Grant Hooper. I am a graduate of the Ohio State University College of Dentistry. I chose to do residency because although I learned a lot at dental school, I felt that it would give me the experience that I would need to treat patients in broader scope. The faculty here have been great at guiding me, and anytime I have a question, they're always willing to sit down and talk to me about anything. In just the past few months of this residency, I've already had the opportunity to perform several endodontic procedures on molars. This is something that my classmates in private practice have not had the opportunity to do. Yeah. At the site, we have up-to-date equipment. We have a cone beam CT machine. Even today, I was able to use it to examine a molar in search of a canal that was difficult to find intraorally, but with the cone beam, we were able to find it. I've also had the opportunity to do several surgical procedures, complicated extractions, that sort of thing. A lot of exposure to surgery that a lot of my classmates haven't had since they graduated.
My name is Dr. Casey Miller. I'm a dentist here at Family Health in Darke County in Greenville. My experience here as an OSU student and as a resident was fantastic. The biggest thing that I really enjoyed about this place is, again, I could focus on the dentistry. I didn't have to worry about overhead. I didn't have to worry about staffing. I didn't have to worry about anything except waking up in the morning, doing good dentistry, and leaving. And doing good dentistry, man, that incorporates basically the entire breadth of what we do here at Family Health. Again, this is not one of those places where you're just doing fillings all day, or you're doing fillings and crown and bridge, or just doing extractions. You can do basically whatever you want between, again, your routine restorative, if you want to focus on that, crown and bridge, extractions, both surgical and complicated, or both surgical and uncomplicated extractions, excuse me. We have the ability to do all types of endo, including molar endo. And the fact that if you come here as a resident, again, if you're not comfortable with any of those procedures, you have one of us to fall back on. You're not going into a private practice environment where some of the, you're asked to do these procedures that you're not comfortable with in an hour. Again, you can hone your skills quite a bit. If there's anything that you want to talk about, not even just related to the residency, but again, if you're admitted to the residency, where to live in town, or even around town. I myself live 45 minutes outside of Greenville in Huber Heights in Dayton. So Dayton is a close enough commute spot to Greenville that, again, you're not going to spend forever in a car, and it's an easy commute. There are a variety of different places north Dayton or along I-75 corridor that you could live other than living in Greenville as well.
My name is Janet Rohr, and I've been with Family Health almost 5 years. I've been a dental assistant for almost 8. I've gotten to see residents grow that I work with. I've gotten to work with several different ones, but mainly one, Dr. Miller, came to us about 3.5, almost 4 years ago, and got to watch him from OSU as a student, kind of come in and start learning how to work with different assistants. It was nice to be able to see him bounce things off other doctors that we have in the facility, and that's what makes us unique, that if they get into a spot that they're unfamiliar with or want a second opinion, that we have people just an arm length away, and everybody's really, really good about trying to help each other.
Some places will say that they're gonna, be a mentor to you. If you're an associate somewhere, they might say that they're gonna have people around, but the reality is, a lot of times they're not gonna be right behind you if you need something in that moment. And here, we're gonna have that support for you.
My name is Jared Pollack. I'm the Executive Director of Family Health Services of Darke County. I've been in that role for 7 months, and prior to that I was an Executive Director of another health center in Ohio, up in Mansfield, Ohio, and prior to that I was in management at another health center in Fremont, Ohio. So I've been at health center work for most of my career, and I can say without a doubt that our dental offices here have a great deal to offer for anyone interested in coming over here to learn their residency and training experience. One of the best things we have to offer is the ability to work with seasoned dentists who can practice in a variety of different techniques, both pediatric dentistry and general dentistry. The experience here in Darke County is an extraordinary one because of the population you get to serve and work with. It's a kind of a perfect scenario where you're working with wonderful people who are team-oriented, and you're treating patients who have genuine respect for the craft and are genuinely appreciative of the services rendered. I think any candidate who is applying for our residency program, or actually in our organization in general, would be very fortunate to end up being able to come here and join us. This is a wonderful organization. I've only been here 7 months, but I feel like I've been here my whole life simply because the people are just so warm and welcoming. So you'd be very lucky to obtain a position here, but we look forward to having you as well.